Hello everyone, my name is Bailey Carricker and today I'm going to be sharing with you the need for more nurse practitioners. This is my audience: Kendall Fowler, Tess Rollins, and Destiny LaCroix. The need for more nurse practitioners is steadily increasing, and the benefits of being one far outweighs the cons. Imagine what it would be like if there was only one doctor per doctor's office or one doctor for every specialty in hospitals. Work would not get done and patients would not get the care they deserve. Living through the peak of the coronavirus in 2020 was a nightmare, especially for those who were laid off, couldn't afford healthcare, or even those who lacked access to healthcare. During this devastating time, nurse practitioners stepped up to give quality care to those under every unfortunate circumstance. Nurse practitioners are known for serving those in rural communities, and they are very cost efficient, ensuring that every dime paid goes to use. Many people have gone through times in their life where money is tight, so it is relieving knowing that nurse practitioners want to help and have our backs. At some point in everyone's life, they need to see a physician. However, due to the increasing lifespan of people and their increased need for medical services, there is a shortage of physicians, but nurse practitioners are slowly but surely picking up the slack. Today, I would like to address first, the need for nurse practitioners, second, the importance of nurse practitioners, and third, how to share with others the impact of nurse practitioners. First, let's address the high demand for nurse practitioners. Although we may not think about it, the demand for nurse practitioners is rather high here in the United States. There is a shortage of physicians across the country, which puts anyone seeking healthcare at risk. Nurse practitioners can perform many of the same tasks that doctors can, which is why we are in dire need of them. Let's dive deeper into why there is a high demand for nurse practitioners across the country. Because of the aging baby boomer population, there is a large portion of the population that needs more healthcare services, meaning there is a need for more doctors, nurses, nurse practitioners, and all healthcare workers. To add to that, due to COVID-19, nurse practitioners were seen as increasingly valuable and needed members of the healthcare teams. This proved in many states that nurse practitioners were able to work on their own without the supervision of a doctor. Because of the ongoing physician shortage, healthcare systems lean more heavily on nurse practitioners. NPs are picking up the slack of the lack of physicians by providing essential services, with over 70% of nurse practitioners delivering primary care today. Research shows that NPs provide equal to or better care than physicians at a lower cost. Nurse practitioners are a practical solution to the physician shortage that is very appealing. We understand why nurse practitioners are in such high demand and why they're important. Now allow me to tell you why we need to know of their importance and impact. Nurse practitioners should be recognized for what they do for patient care that those on the outside do not see. This will spread awareness and open opportunities for those who do not have a full understanding of what a nurse practitioner is. I believe an increase of nurse practitioners will lead to more patient satisfaction because NPs focus more directly on the patient than doctors, which allows them to form a personal connection to their patients. To start off, nurse practitioners aren't typically booked as doctors, which allows for patients to be seen sooner. Nurse practitioners help patients feel comfortable, healthy, and looked after throughout any medical routine. Nurse practitioners are very valuable in healthcare settings. Therefore, there needs to be more to ensure that everyone can receive the healthcare they need and deserve. NPs provide services that are more cost efficient for patients. They also develop trusting relationships with their patients and improve obedience from patients and their treatment plans. Because of this relationship, patients feel comfortable reaching out to their nurse practitioners when necessary. Without an abundance of nurse practitioners, citizens will not receive care as intensive or frequently. When going into a doctor with a personal health issue, you want someone to care for you that you trust. More than likely, you won't trust a stranger as much as you would trust a friend. NPs strive to be a friend so that patients feel completely comfortable with sharing their problems and trusting their care provider. Let's put into perspective what it would be like without NPs. Imagine going to a crowded hospital with only 3 doctors and 0 nurse practitioners. You are experiencing severe pain but are unable to be treated because there are 30 other patients ahead of you. You are in desperate need for help, but there is a physician shortage, which means you must wait your turn. On the other hand, let's observe the world with nurse practitioners. On average, nurse practitioners see about 3 patients per hour. Now imagine you're at a hospital that still only has 3 doctors but also has 6 nurse practitioners. Although there are still 30 patients ahead of you, your wait time just decreased significantly. This is due to NPs being able to take on the same roles and responsibilities as doctors. With this in mind, we need to be aware of how to spread the impact of nurse practitioners with others. By spreading awareness for the need of nurse practitioners, people everywhere will understand why NPs are so critical, and who knows, maybe they will consider taking on the profession themselves. It is important for those who contain this knowledge of nurse practitioners' importance to share with those who are unaware, because no one wants to be the one sitting in the waiting room for hours in despair while waiting for a doctor. There are different ways to get involved with providing awareness, some of which do not take much effort and some take a little bit more. You can shadow at hospitals and clinics to receive hands-on experience and potentially shadow a nurse practitioner. A simpler way to get involved is to share articles, stories, and resources on social media platforms. By spreading awareness for the high demand of nurse practitioners, you are helping to ensure that nurse practitioners are in healthcare settings everywhere. I hope this presentation has helped you grasp just how important nurse practitioners are in today's world. Maybe I have even convinced someone in the audience to pursue a career as a nurse practitioner. Remember that we need nurse practitioners because they help healthcare facilities run more efficiently and smoothly. They also harvest the same skills as doctors and provide direct patient care, forming a bond with patients. Perhaps next time you are at the doctor or hospital, a nurse practitioner will be the one to save your day. Here is my Works Cited page. Thank you for your time, and I hope that you took something from this presentation. Again, here's my audience: Kendall Fowler, Tess Rollins, and Destiny LaCroix.